Your brain is the command center for your body. It works alongside your spinal cord to send messages back and forth to the body. Your brain controls your thoughts, emotions, memories, speech, sight, movement, and even breathing. A brain injury can disrupt these functions and affect your everyday activities. A brain injury occurs when part of the brain is damaged. Damage to the brain can occur in many different ways. The damage can be caused by something internal, like a stroke or a disease, or can be caused by something external, such as a fall, a gunshot wound, or an automobile accident. An injury caused by something external is called a traumatic brain injury. There are primarily two types of traumatic brain injuries: a diffuse injury and a focal injury. A diffuse injury can cause damage to several parts of the brain where neurons become sheared or torn. A focal injury causes damage to a specific part of the brain. Brain injuries are different for each person because of the way they occur, which part of the brain was injured, and the severity of the injured area. Brain injury rehabilitation may include therapies like speech, occupational, physical, neuromusic, and recreation. Your brain is divided into the right hemisphere and the left hemisphere. The left side controls calculating, speech, and reasoning. The right side manages intuition, creativity, emotions, art, and music. One surprising fact is that the right side of the brain controls muscles on the left side of the body, and the left side of the brain controls muscles on the right side of the body. Therefore, damage to one side of the brain will affect functions to the opposite side of the body. Let's take a look at what an injury may look like to the different areas of the brain, although this is not a complete list. An injury to the frontal lobe may cause problems with behavior control and make it more difficult to plan and problem solve. An injury to the temporal lobe may affect a person's ability to understand what is being said to them. They may also have problems with hearing and memory. An injury to the parietal lobe may interfere with a person's ability to sense touch, temperature, and pain. An injury to the occipital lobe may cause a person to have trouble recognizing familiar faces. They may also have problems with depth perception and even distinguishing color. The cerebellum is the bottom part of the brain. An injury to this part would make it hard to find balance and coordination with the body. The ability to stand upright may not be possible. The brainstem is responsible for all vital functioning. This includes heart rate, blood pressure, swallowing, and breathing. Some people with a brainstem injury may need a ventilator to help them breathe. Generally, some changes that may occur after a brain injury include your ability to walk, speak, even your ability to swallow may become more difficult. Some people can feel overstimulated by everyday activities. A person with a brain injury is at a higher risk of having a seizure. Seizures are serious and can lead to further injury, so it's important that caregivers are prepared and learn how to react to seizures. Your brain can be resilient. However, some injuries may leave permanent symptoms and may require adjustments. Create an environment that helps promote safe behaviors. Reduce overstimulation by minimizing noise and eliminating clutter. It's important to practice patience and be dedicated to your loved one's recovery process. Here at Craig, our team of nurses, doctors, and therapists have a wealth of information about brain injury. Since each person's injury is unique, it's important to talk to your care team to find out more about your care plan.